in general, what my board wanted, I think, for me was to more enthusiastically embrace these changes to the hospitals. And so when I would go testify in the midst of this, when the match rate was being cut and it was being put on LSU, what I was being encouraged to do is describe that as a positive, an opportunity for LSU to modernize or transform ourselves, and I couldn't do that because we're a pretty modern operation today. If you look at what people are describing in terms of where the healthcare delivery system in the United States needs to go, they describe things as having robust electronic medical records. Well, we have a statewide electronic medical record. They look at having coordinated care from the inpatient to the outpatient. Well, LSU does that very well already. It talks about having disease management. We have disease management programs that are very mature now because we've been doing them since 1997. And a lot of metrics to support that they're being done very well. They talk about having medical homes. Well, LSU has more certified medical homes than anybody else in the state. And so all of these things that are associated with modern delivery systems we've done and have been doing for a number of years, and so but the characterization was that we had to modernize, and to modernize we had to move business out of our system and put that in other delivery systems. And so I couldn't sell that because it's not true. And so in general, I think that was the issue. There other things, policy stances of the administration that clearly I didn't agree with. The Medicaid, whether or not to take the Medicaid expansion. I can think of an instance where before I had testified before committee, I was instructed not to get into the Medicaid expansion. And so when I was asked about whether I thought that was a good deal for the state to take to participate in the Medicaid expansion or not, I had to tell them, well, my board has asked me not to address that. And so I think they would have preferred if I could be more enthusiastic about how that was a good idea, but I don't think it's a good idea.
Right.
And so as a leader in the past, LSU had crafted or had a different philosophy about that delivery system. In 1997, Merv Trail went to the legislature and made the case that it was important for LSU as the public education arm, health education arm, to have a closer connection with the public delivery system because those things are very closely intertwined. And I think LSU made a lot of progress since then in improving care in that system and improving medical education in that system. It's only been recently that LSU's position on that has changed with this current board, and I am part of the workforce that embraced the old LSU position on that. And so I think, in general terms, that was it. Was it one specific thing? No, it was, in general. I kept trying to make our system work in the setting of recurring cuts, and it became clear that the goal was not to make it work in the setting of continued cuts, but to have continued cuts to force transition to something else.